This coronavirus is starting to make people nervous.
The coronavirus.
The coronavirus.
Coronavirus.
The coronavirus.
Coronavirus is spreading across the world in borderline pandemic.
Coronavirus.
The coronavirus.
The coronavirus.
The coronavirus.
The coronavirus.
Coronavirus.
The coronavirus.
All about the coronavirus outbreak.
What do you know about COVID-19?
Not much, actually. I think it's something that attacks your respiratory system, and it's affecting elderly more than anything, and not affecting children. That's really it.
Are you worried?
Not really.
It's not that big of a deal. Like, I'm pretty sure, like, I've heard that if, like, a person our age gets the coronavirus, it's most likely, like, weeks over. Like, you survive it, and it's not really serious, in my opinion.
Just describing the symptoms, it doesn't seem dangerous as long as you're not above 60 or below 10. And so, as someone who's, in his 20s, it's, if I get it, I get it. I do understand that the concern is that it spreads so easily. But I think that maybe this has all gone a little over the top in terms of the fear.
Because I'm 31 and I feel relatively healthy, I don't think that if I do get it, I would be able to take care of myself and get through it. So I'm not super scared now.
With this disease, in some respects similar to influenza, but in some respects very different, it spreads very easily. You can even spread it when you're not symptomatic. So it's insidious and treacherous in that you could spread it easily. The other part about it that's really so different from anything that we've ever faced before is that if you look at the mortality of seasonal flu, the thing that you and I go through every season, the mortality is about 0.1%. That's a lot. And we get used to that morbidity and mortality. But the mortality of this is about 10 times that. It's at least 1%. So it's a disease that not only is easily spread, but it can be devastating, particularly for a certain subset of the population. Demographically different. The elderly, those with underlying conditions, heart disease, lung disease, diabetes. It can be very serious for them with a high degree of mortality.
I know that it's spreading, it has been spreading throughout areas of Asia and Europe, and it's actively in the US as of right now. I know that it's new, and I think that that's why the CDC is issuing a lot of these warnings just to take precaution, and I definitely agree with that, but I'm still out trying to live life at the same time. So.
I'm wearing the mask because I woke up this morning and I was on my phone and I seen there were 6 coronaviruses in LA, so coincidentally my chick had to go to the hospital and we went, so I got masked and I've been masking ever since.
I think it's being blown out of proportion.
I'm really pissed at the way the press is reporting coronavirus.
Our district manager had been joking about it, and he was kind of like what felt like mirroring Trump, as in making fun of it, and the media is the one to blame. They're making everybody scared. It's not a big deal. Who cares? The media is just blowing it way out of proportion. They're creating so much panic. It's their fault, blah, blah, blah. And then I think it was the next day when our attendance was extremely low. And I think something had come out in the news, and it was, I think it was like they had shut down Italy, the borders. And that's when Ed came in the office and was like 180 flipped. It was like, oh, this this is serious. Oh, I'm a little scared. He literally said that, which made me scared because I was thinking it was going to be a big thing, but I didn't quite realize that it would reach this deep into regular life. So, yeah.
Irresponsible news media causing this. Look at this. This is not necessary. They're running out of toilet paper. This is not necessary. We're not running out of toilet paper, but we are now because look. Okay.
Well, we are buying more water and toilet paper because all the stores are being ransacked for that. So that's pretty much the extent of our preparations.
One of the things that we are lacking is hand sanitizer, just because it is very out of stock now, just because people are taking very close precautions and taking all the supplies.
I think I'm a little concerned about the amount of food that I have, just based on the amount of food that is not on the shelves right now. So I'm not entirely sure what I should do about that, but we'll ration.
Now it's even become harder to locate, actual news from like CDC or, because I mean, that's all they're jumping on. I mean, it's horrible. That alone, if you go on social media, will stress you out.
We're going in right now. The most hectic section of Target right now is the cleaning and disinfection section. Wow. Sure.
Today, the World Health Organization officially announced that this is a global pandemic.
Breaking news here on CBS Sports HQ. The NBA has suspended the season after Rudy Gobert has tested positive for coronavirus.
Now, moving on to the next sport, that Major League Baseball will, in fact, suspend all operations indefinitely. Of course, a lot of questions. What does that mean? We do not have those details at this time, but we can tell you that all operations are going to be suspended indefinitely.
Tom Hanks revealing he and his wife, actress Rita Wilson, have tested positive for the virus.
A volatile session on Wall Street today. The markets were down, then they were up, then they were down again. So let's take a look. We're just heading into the close. It's settling there about 793 points lower on the Dow today after the Fed cut rates this morning because of the coronavirus.
I'm more worried about the panic aspect of it, because I think there are some people out there that maybe aren't as educated as they could be about it. So I was talking to a friend earlier today about this panic. It's like people buying, 5 months worth of toilet paper, and how that kind of cascades and affects everyone else.
Yeah.
Well, I don't buy 5 packs. I buy once. I go to Costco once a month, but that affects me now. So then, what am I going to do next time? Well, now I might buy 2 or 3. So it's kind of like this, cascade effect of now that panic, maybe of not, having that education. It really, that can affect. So I'm more scared of kind of those effects, not scared, but, concerned with those effects that it might have.
Gridlock outside. Gridlock inside, too.
You guys got to be fast. People, move.
This shit is deadly, so I'm taking all precautions for sure. For sure.
They've decided to close Disneyland Park and Disneyland California Adventure starting this Saturday morning through the end of the month.
So I think it's been about a week since we last talked. How do you feel about everything going on now? Because there's been quite a few developments.
I'm a little nervous now. More nervous than last week. I've gone out and bought a lot of canned food.
It's very different, even in the time span of 1 week. So I'm just a little I'm definitely more concerned than I was last week, considering everything that's happening, in Italy, and of course China. But I think that it is a little bit more unnerving than it definitely was last week. So. Yeah.
Not really preparing in the sense of being quarantined or being out of supplies, because I don't think and hopefully it won't, but it hasn't come to that point yet where we need to start to really go out there and,
Los Angeles is issuing a safer at home, stay at home order. But all businesses, including museums, malls, retail stores, for-profit companies, and nonprofit organizations must stop operations that require workers to be present in person, because you're safer at home. And the only people who should be leaving home and going out are those whose jobs are critical to the safety, the health, and security of the city, as well as the economy of recovery for us and the nation during this crisis. Emergency personnel, first responders, government employees, medical professionals, and vital infrastructure workers will be able to continue their jobs, but they need to exercise the social distancing that can save their lives whenever and wherever possible. The same applies only to critical businesses such as healthcare providers, grocery stores, news outlets, hardware stores, gas stations, dry cleaners, and laundromats, which are permitted to remain in operation.
A certain small percentage of the people that have that active infection could become more ill and require healthcare services. And so if the wave is very big, then there will proportionally be more people that need healthcare services. And what we want to do is try and flatten the wave so that it's within the capacity of our community's healthcare system to handle anything that comes our way, whether it's sick kids that have cough and cold and need attention, or whether it's somebody that's very ill and needs to be in the hospital and treated for pneumonia. So when people hear about that flatten the curve or flatten the wave concept, that's the idea with why we think about social distancing. Is the more we can slow down transmission of this virus, the slower the onset in the community of this infection, and the more capacity we have as a system to care for everybody's needs as it happens.
Then you have like, well, how long? And I get it. The answer is going to be depends where you are. I get it. But if it's California and there you have the governor and the mayor discussing, the Los Angeles mayor, that it's going to be months. It's going to take months for them. And then you're hearing here in New York, Andrew says, the governor here says, we're 2 or 3 weeks from seeing the worst crush at the hospitals. I mean, it seems that the timeline is getting extended farther out. Not that things are going better than expected anywhere.
Yeah. What you've got to do, Chris, you've got to be realistic, and you've got to understand that you don't make the timeline. The virus makes the timeline.
Also, thoughts are scared for the economy, like especially the people that work with the public, because I'm a restaurant manager, so I see there's like all my servers and cooks and bussers and hostesses and back of the house staff and even all the vendors that are going to be delivering to restaurants. Everybody is not going to be working, and what are they going to do for 2 weeks with no pay? Are they going to be able to pay for things, or is everybody going to go on credit card debt? What the hell is going to happen? Something bad, something big, some sort of big change. Feels very huge.